Deafness. It is inability of an individual to hear either wholly or partially. The deafness is of two types: conductive deafness and nerve deafness. Conductive deafness, here the defect is in the conduction of the sound due to the impaired sound transmission. Some of the causes for conductive deafness are ear wax, defect in vibration of tympanic membrane, infection of the middle ear, that is otitis media, otosclerosis, or eustachian tube blocked due to the common cold. Nerve deafness occurs because of the damage to the hair cells in the neural pathway. Some of the causes could be hereditary, injury to the eighth cranial nerve, drugs like streptomycin, vascular causes, or maybe industrial noise pollution. Tests for hearing, they are mainly the watch test, tuning fork test, and audiometry test. Auditory acuity, that is sharpness of hearing, can be measured with the help of an audiometer. This test helps to assess the degree of deafness and the frequency range in which deafness is most affected. The device consists of the following parts, that is electronic oscillator, intensity dial, and headphone. These are some of the common tuning fork tests which are done: Rene's test, Weber's test, and Schauberg's test. In Rene's test, the base of the vibrating tuning fork is placed on the mastoid process until subject no longer hears it. That is bone conduction, and then it is held in the air next to the ear, which is going to test the air conduction. Normally, subject hears vibration in air after bone conduction is over. Air conduction is better than bone conduction, that is Rene's test positive. In conductive deafness, vibration in air not heard after bone conduction is over, that is bone conduction is better than air conduction, where the Rene's test becomes negative. In nerve deafness, if partial nerve deafness, Rene's test is positive. If complete nerve deafness, both air conducted and bone conducted sounds are not perceived. In Weber's test, base of the vibrating tuning fork is placed on the vertex of the skull in the middle or over the mandible. Normally, both the ears hear the sound equally well. In conductive deafness, sound is better heard in the affected ear, whereas in nerve deafness, the deaf ear remains deaf due to the bone conducted sound, and sound is thus better heard and perceived by the normal ear, that is, it is lateralized to the healthy ear. Schauberg's test is done by bone conduction. It is going to determine the bone conduction of the subject compared with that of examiners, assuming that the latter is normal. So here, in normally, both the subject and examiners hear the sound waves equally, and in conductive deafness, subject's bone conduction is better than that of examiner, and in nerve deafness, subject's bone conduction is worse than that of examiner.